Good afternoon, everybody. It's been a week today since I have posted my last vlog. It's been an interesting week, let me tell you. The last one I posted, it was talking about my rheumatologist appointment. I got home and I decided I was feeling good, so I was going to go check the mail. We live in this house and the driveway is real gravelly. And so I have noticed here lately that when I walk out there that the gravel kind of slips with me. But also my Apple Watch has been telling me that I've been having an unsteady walk and that I was a fall risk. So, leave it to me. I went out to check the mail and got halfway down the driveway and fell flat on my face. So I thank the Lord I had my cell phone with me and I was able to call Chastity and them and tell them to come out and help me, that I need their help. So they come and got me and I hobbled to the house. My right ankle, undoubtedly I must have sprained it when I fell, and because it was so swollen. I hit my forehead right here and got a cut on my chin. Broke my other glasses that I had. But the main thing was on my left side, I think I landed on a big rock, but my chest has been hurting. So my son took me to the emergency room and they did x-rays and scans on me, and they said that there was nothing broke. So they first said I had, what the doctor said I had was injured something about my chest wall. I can't remember exactly what they told me. But as the week has went on, to cough, to yawn, to move, that left side has hurt. If you notice, I'm in my recliner because it hurts for me to sleep in my bed. So I'm sleeping in my recliner to help me so I can get up without having to strain my chest muscle. But Chastity wanted me to go get another x-ray, and I'm tired of doctors, y'all. I am sick and tired of doctors. So I decided, okay, so I Googled my symptoms of what was going on. And it says a bruised sternum. That may be the same thing as a chest wall. I don't know. But everything was lining up to what, diagnosed as a bruised sternum. So I'm trying my best to get over it. I had a better day today than I did before, but now it's starting back in again. So, but anyway, my doctor called me back and said my iron was low. So I've got to start on iron pills again. And I don't know what's causing my iron to get low. They've already done the test, my GI doctor, to see if I had any bleeds inside, and everything was good. So I don't know what's causing my iron low. But anyway, and then, I also told you about, talked to you about fibromyalgia and the signs and symptoms. And I said that I was going to try to do one on each one of my diagnoses as far as the autoimmune problems. So this one is about I used to call it Sjogrens, but I see it is Sjogrens syndrome. But anyway, it's a disorder of your immune system, identified by its two most common symptoms: dry eyes and a dry mouth. That's the reason why I sit when I'm videoing and lick my lips a lot. My eyes bothers me. They get dry, itchy. Excuse me. It's getting late. It's time for me to go to bed, if I can. The condition often accompanies other immune system disorders such as rheumatoid arthritis and lupus. In Sjogrens, there we go again, syndrome, the mucous membranes and the moisture-secreting glands of your eyes and mouth are usually affected first, resulting in a decreased tears and saliva. Although you can develop Sjogren's syndrome at any age, most people are older than 40 at the time of diagnosis. The condition is much more common in women. Treatment focuses on relieving symptoms. Okay, and we know that two things is the dry eyes and dry mouth. But some people with Sjogren's syndrome also have more of the following: joint pain, swelling, and stiffness, swollen salivary glands, particularly the set located behind your jaw and in front of your ears, skin rashes or dry skin. I've got dry skin. Other dryness, persistent dry cough, prolonged fatigue. So when you've got a number of these disorders that act the same thing, you're tired. Causes Sjogren's syndrome is an autoimmune disorder. Your immune system mistakenly attacks your body's own cells and tissues. Scientists aren't even certain why some people develop Sjogren's syndrome. Certain genes put people at higher risk of the disorder, but it appears that a triggering mechanism, such as an infection with a particular virus or strain of bacteria, is also necessary. And my white blood count stays elevated. So they're saying it's inflammation. Okay. In Sjogren's syndrome, your immune system first targets the glands that make tears and saliva, but it can also damage other parts of your body, such as joints, thyroid, kidneys, liver, lungs. Okay. And it says about the kidneys or liver, inflammation can cause pneumonia, bronchitis, or other problems in your lungs, lead to problems with kidney function, and cause hepatitis or cirrhosis in your liver. Lymph nodes, a small percentage of people with Sjogrens syndrome develop cancer of the lymph nodes, lymphoma, which they checked me for that, and so far that's not the case with me, thank the Lord. Nerves, you might develop numbness, tingling, and burning in your hands and feet, and that's called peripheral neuropathy. And I've been diagnosed with neuropathy, but they thought it was from the diabetes. It's a rheumatic disease. It's common with people who have Sjogren's syndrome to also have a rheumatic disease such as rheumatoid arthritis or lupus, which I don't have either one of those. But when you have this, you have the complications are dental cavities because you don't have enough saliva in your mouth to help keep the bacteria away. Yeast infections, which I used to be really bad about getting, what do they call that? It's a yeast infection in your mouth, but I can't remember the name of it. But I used to have that magic mouthwash. And vision problems. Dry eyes can lead to light sensitivity, blurred vision, and corneal damage. I don't have corneal damage yet, but I do have a lot of problems with seeing, even after my cataract surgery. Now, like I said in the last vlog, my primary is the fibromyalgia. The secondary is the Sjogren's. And the third one is it's called Raynaud's. So I will talk to you next time, probably next week, about Raynaud's. I had noticed my hands had a funny look on them all the time, and we was trying to figure out what was going on, and it's the Raynaud's. So, but anyway, I just wanted to touch base with you guys and let you know what was going on. Boy, that first step is a doozy. So, anyway, y'all take care and have a blessed day. And, you know, Thanksgiving's coming up on us, but surely we need to be thankful every day. So, bye-bye.